Anatomy of parotid gland and parotid region. Parotid gland is the largest of the three major salivary glands. It is enclosed in its own capsule, which is a reflection of the deep fascia. Superficially, the parotid gland is located on the side of the face lying, in part, over the masseter muscle, anterior to the ear and superior to the zygomatic arch. It is irregular in shape and therefore is wedged in between the ramus of the mandible and the space pos-terior and medial to it. That space is called the parotid bed. Many finger-like projections of the parotid gland fill this irregular space with glandular tissue. Thus, there are no definite descriptions as to the extent of the gland within the parotid bed. The parotid gland, the largest of the three major salivary glands, is encapsulated by portions of the deep cervical fascia. Part of the gland lies on the lateral surface of the masseter muscle, whereas most of it lies within the parotid bed with finger-like projections between some muscle masses in the deep face. The parotid gland is the largest of the three major salivary glands, parotid, submandibular, and sublingual glands, and is enclosed within a capsule that is part of the deep cervical fascia. It is located on the lateral aspect of the face and in the parotid bed. The parotid gland relations. Because the gland is molded into an irregular space, it is also irregular in shape. 1. The superficial aspect of the gland extends superiorly over the masseter muscle to the zygomatic arch, where an accessory portion of the gland may be detached from the main substance. 2. Inferiorly, it is mostly confined to the region between the mastoid process, the sternocleidomastoid muscle, and the angle of the mandible, where it extends over the posterior aspect of the masseter muscle. 3. Medially, the gland extends into the deeper portions of the parotid bed to the styloid process and its attached musculature. Here, a wedge-shaped portion of the gland may intervene between the medial and lateral pterygoid muscles for a short distance. 4. Often, glandular lobes extend into other spaces adjacent to the parotid bed. One such lobe passes between the ramus of the mandible and the medial pterygoid muscle, above that muscle's insertion, whereas other lobes pass between the external auditory meatus and the temporomandibular joint, TMJ, and between the external carotid artery and the superior constrictor muscle of the pharynx. Parotid duct, also known as the Stenson duct, exits the most anterior superficial portion of the gland to travel, just deep to the skin, over masseter muscle on the lateral aspect of the face. It then dives, at the anterior border of the masseter, into the buccal fat pad. The duct then pierces the buccinator muscle to enter the oral cavity at the parotid papilla located in the buccal vestibule opposite the second maxillary molar. Parotid salivary secretions are delivered into the oral cavity through the parotid papilla. Exiting the anterior aspect of the superficial portion of the gland is the parotid ductal Stenson duct, which passes anteriorly, superficial to the masseter muscle, to dive medially into the buccal fat pad. It pierces the buccinator muscle on its way to the oral vestibule. It delivers the parotid salivary secretions at the opening of the parotid papilla located opposite the second maxillary molar. Relationships. Many structures passing between the neck and the head, including arteries and veins as well as several cranial nerves emanating from the brain, pass through the parotid gland. Because the parotid gland is irregular in shape, possessing many finger-like projections radiating in several directions from the parotid bed, the gland associates with or engulfs many of the structures passing through this region. 1. Structures associated with the superficial aspect of the gland include branches of the great auricular nerve originating from the cervical plexus that provide sensory innervation to the region, and small lymph nodes that drain the superficial area. 2. Structures associated with the deep aspect of the gland, provided it sends projections medial to the styloid process, include the 1 external and internal carotid arteries, the internal jugular vein, and both the vagus and glossopharyngeal nerves. 3. The external carotid artery enters the substance of the gland, and it is there that several of its branches arise, including the posterior auricular, maxillary, and superficial temporal arteries. 4. The retromandibular vein, as well as the veins uniting to form it, also pass through the gland. 5. The facial nerve, cranial nerve 7, exits the stylomastoid foramen and enters the substance of the gland. While in the gland, the facial nerve forms a plexus before exiting the gland to innervate the muscles of facial expression. 6. The auriculotemporal nerve, a branch of the mandibular division of the trigeminal nerve, cranial nerve V, enters the substance of the gland from its deep aspect along the neck of the mandible and emerges from the gland just inferior to the root of the zygomatic arch. While within the gland, it communicates with the facial nerve and distributes fibers to the gland. The structures entering the parotid gland exit from its posterior, superior, inferior, and anterior surfaces. 1. The posterior auricular artery exits from the posterior aspect of the gland. 2. The superficial temporal artery and vein. 3. Auriculotemporal nerve. 4. Temporal branches of the facial nerve may be observed at the superior margin of the gland. 3. Inferiorly, 1. The retromandibular vein exits the parotid gland just before joining the posterior auricular vein to form the external jugular vein. 2. Emanating from the entire facial margin of the gland are the terminal branches of the facial nerve, grouped into 5 major branches: the temporal, zygomatic, buccal, mandibular, and cervical branches. Vascular supply. 1. The posterior auricular artery is the major vascular supply to the parotid gland. The posterior auricular artery, arising from the external carotid artery within the substance of the parotid gland, provides branches that vascularize the gland. 2 additional small glandular branches arising from the superficial temporal and transverse facial arteries also supply the gland. Venous drainage. Venous drainage is via the veins passing through the gland, and these vessels empty into the external jugular vein. Lymphatics. Lymph nodes are located within the gland and drain into the cervical lymph nodes. Lymph percolating through lymph nodes located superficially and within the substance of the gland is delivered into the superficial and deep cervical lymph nodes. Innervation. General sensation to the parotid gland is provided by the great auricular nerve of the cervical plexus. 1. Sympathetic innervation is supplied by the carotid plexus. The sympathetic component of the autonomic nervous system reaches the gland via postganglionic sympathetic fibers derived from the carotid plexus. These fibers travel on the external carotid artery and its branches that course through the gland. Sympathetic innervation to the parotid gland mediates vasoconstriction to these vessels. 2. Secretomotor innervation is supplied by the glossopharyngeal nerve and delivered to the gland by the auriculotemporal nerve. The parotid gland receives sensory and autonomic innervation. 3. General sensation is provided by branches of the great auricular nerve, from the cervical plexus, as it ramifies over the surface of the gland. 4. Parasympathetic innervation is distributed to the gland by the auriculotemporal nerve, a branch of the trigeminal nerve, cranial nerve V, even though these parasympathetic fibers do not arise within the trigeminal complex. A. Preganglionic parasympathetic fibers, from the glossopharyngeal nerve, cranial nerve 9, pass from its tympanic branch via the lesser petrosal nerve to the otic ganglion, where they synapse on postganglionic cell bodies. B. Postganglionic parasympathetic fibers from here then join the auriculotemporal branch of the mandibular division of the trigeminal nerve, to be distributed to the gland affecting secretomotor functions. Parotid secretomotor innervation. Although secretomotor innervation to the parotid gland is described as being provided from the glossopharyngeal nerve, cranial nerve 9, some evidence suggests that the facial nerve may supply parasympathetic innervation to the parotid gland in addition to that from the glossopharyngeal nerve. The internal carotid artery and the parotid gland. The internal carotid artery ascends in the neck deep to the parotid gland within the carotid sheath in company with the internal jugular vein and the vagus nerve. Several arteries arise from the external carotid artery and pass near or through the parotid gland. The internal and external carotid arteries arise in the neck from a bifurcation of the common carotid artery at the level of the superior border of the thyroid cartilage. The internal carotid artery then ascends in the neck, providing no branches before it enters the carotid canal of the petrous portion of the temporal bone. In its ascent deep to the parotid gland, the digastric muscle, and the muscles attached to the styloid process, this artery is contained within the carotid sheath in company with the internal jugular vein and the vagus nerve, cranial nerve X. 7 branches originating from the external carotid artery inferior to the parotid bed, such as the lingual and facial arteries, are discussed in appropriate chapters. Several arteries either originate in or are in close association with the parotid bed and are, point 1. The ascending pharyngeal artery, arises from the external carotid artery near its origin and ascends between the pharynx and the internal carotid artery. Through its several named branches, it supplies some of the prevertebral muscles, a portion of the tympanic cavity, and portions of the soft palate. Pharyngeal branches arise to supply the stylopharyngeus and the pharyngeal constrictor muscles before the ascending pharyngeal artery terminates as 2 or more meningeal branches that enter the jugular foramen to ascend into the cranium. 2. The occipital artery, originates from the posterior aspect of the external carotid artery just before the external carotid dives deep to the posterior belly of the digastric muscle. The occipital artery courses under the cover of the digastric and stylohyoid muscles, supplying both via muscular branches, as it passes posteriorly to groove the mastoid process of the temporal bone. This artery supplies the sternocleidomastoid muscle, auricle, posterior neck musculature, and meninges through its named branches, whereas the terminal branches serve the scalp and its musculature. The internal and external carotid arteries become separated from their close association in the parotid bed as they pass deep and superficial, respectively, to the styloid process. The superficial position places the external carotid within the substance of the gland and, while there, the posterior auricular artery arises, as do the 2 terminal arteries of the external carotid, the maxillary and superficial temporal. 3. The posterior auricular artery arises near the apex of the styloid process and, passing through the parotid gland that it supplies, sends branches to the digastric, stylohyoid, and sternocleidomastoid muscles. Named branches include the stylomastoid artery, which enters the like-named foramen to supply the tympanic cavity, the auricular artery, passing to the posterior aspect of the ear, and the occipital artery, which supplies the scalp and occipitalis muscle. 4. The maxillary artery arises from the external carotid artery as it nears the deep aspect of the neck of the mandible, while within the gland, branches named the deep auricular and anterior tympanic pass posteriorly to the ear and tympanic cavity. The artery then passes anteriorly between the ramus of the mandible and the sphenomandibular ligament, where it exits the substance of the gland to enter the deep face. The smaller, terminal superficial temporal artery exits the parotid gland to become superficial as it crosses the zygomatic arch posterior to the mandible, in company with the auricula temporal nerve. While within the parotid gland, the artery sends unnamed branches to the gland, the TMJ, and the masseter muscle. 5. The transverse facial artery also originates within the parotid gland and exits that structure between the zygomatic arch and the parotid duct. Other named branches arising from the superficial temporal artery include the middle temporal, zygomatico-orbital, anterior auricular, and terminal, frontal, and parietal branches. These branches freely anastomose with other arteries distributing to these same areas. The facial nerve and parotid gland. The facial nerve exits the cranial vault via the stylomastoid foramen. It then enters the parotid gland where it forms a loop from which arise the 5 terminal nerves that provide motor innervation to the muscles of facial expression. The facial nerve, cranial nerve 7, exits from the cranial cavity at the stylomastoid foramen located in the temporal bone just posterior to the styloid process. On exiting, it communicates with the glossopharyngeal and vagus nerves and with the great auricular nerve of the cervical plexus. The auriculotemporal nerve from the mandibular division of the trigeminal nerve communicates with the facial nerve after it has entered the substance of the parotid gland. Presumably, this communication provides general sensory fibers from the trigeminal nerve to the facial nerve for distribution to the face. Branches arising from the facial nerve as it passes through this area include the posterior auricular, digastric, stylohyoid, and parotid plexus with its terminals. The posterior auricular nerve arises near the stylomastoid foramen and ascends behind the ear. This branch supplies motor innervation to the auricular and occipital muscles. The digastric and stylohyoid branches provide motor innervation to the like-named muscles as each branch arises near that muscle. On entering the substance of the parotid gland, the facial nerve terminates into 2 communicating branches, often forming a loop within the gland. The superior of these is the temporofacial branch, whereas the cervicofacial branch is the inferior portion of the nerve. Arising from this parotid plexus are the 5 major nerve branches emanating from the facial aspect of the parotid gland, ramifying over the superficial face as the temporal, zygomatic, buccal, mandibular, and cervical branches serving the muscles of facial expression with motor innervation. Muscles: 1. The masseter muscle, which is attached to the lateral aspect of the ramus of the mandible, is in intimate association with the parotid gland. 2. The digastric muscle, it will be recalled, serves to form the boundaries of several of the subtriangles in the anterior triangle of the neck. It is composed of paralysis. Total destruction of the facial nerve results in complete facial paralysis, Bell palsy. 2 separate bellies united by an intermediate tendon at the hyoid bone, and also assists in forming the medial boundary of the parotid bed. Its posterior belly, the only portion associated with the parotid bed, arises from the mastoid notch on the temporal bone and passes antero-inferiorly to the hyoid bone. It is about this bone that the intermediate tendon unites the 2 bellies, as the tendon perforates the stylohyoid muscle near its insertion on the hyoid bone. The posterior belly of the digastric muscle is innervated by a branch of the facial nerve that enters its deep surface at about mid-belly. With its anterior component, the posterior belly functions to fix the hyoid bone. Specifically, the posterior belly pulls the hyoid bone posteriorly. 3. The stylohyoid muscle, another muscle forming the medial boundary of the parotid bed, arises from the posterior and lateral aspects of the styloid process of the temporal bone. The origin of this muscle places it anterior to the posterior belly of the digastric. The 2 muscles are rather closely associated because the stylohyoid also passes antero-inferiorly to insert on the body of the hyoid bone. The muscle is perforated, as described previously, by the digastric tendon. The stylohyoid muscle is innervated by a branch of the facial nerve, which passes very close by, on its way to the parotid gland. This muscle, not unlike the posterior belly of the digastric, assists in fixing the hyoid bone by pulling it posteriorly and superiorly. 3. The styloglossus and stylopharyngeus muscles. The styloglossus muscle arises from the styloid process and inserts into the side of the tongue. Muscle is innervated by the hypoglossal nerve, cranial nerve 12, and functions to draw the tongue superiorly and posteriorly. The stylopharyngeus muscle arises from the styloid process and inserts into the lateral wall of the pharynx between the superior and medial pharyngeal constrictor muscles. The glossopharyngeal nerve, cranial nerve 9, innervates this muscle, which functions to elevate the pharynx and larynx. Ligaments. 1. Stylohyoid ligament. The stylohyoid ligament, formed by a thickened portion of the parotid fascia, helps to separate the parotid and submandibular glands. Associated with the stylohyoid muscle and the styloid process is a ligamentous band, the stylohyoid ligament, suspended between the tip of the styloid process and the lesser cornu of the hyoid bone. This ligament, formed by a thickening of the deep parotid fascia, assists in separating the parotid and submandibular glands, as does the similarly formed stylomandibular ligament, described as an accessory ligament to the temporomandibular joint. 3. Nerves and arteries deep to the styloid process are the glossopharyngeal, accessory, and hypoglossal nerves. However, the vagus nerve is within the carotid sheath along with the internal carotid artery and the internal jugular vein. Immediately deep to the muscles originating on the styloid process are the last 4 cranial nerves, the internal carotid artery, and the internal jugular vein. The glossopharyngeal, vagus, and accessory nerves exit the skull through the jugular foramen, whereas the hypoglossal nerve exits the skull via the hypoglossal canal. As these nerves descend to the structures they innervate, they may be observed passing on the lateral surface of the internal carotid artery and internal jugular vein housed, along with the vagus nerve, in the carotid sheath. Within the carotid sheath, the laterally placed internal jugular vein, originating at the jugular foramen, descends to enter the subclavian vein at the root of the neck. The internal carotid artery ascends within the sheath to enter the carotid canal in the petrous portion of the temporal bone, whereas the vagus nerve descends through the neck on its way to the thorax and abdomen. Infection of parotid gland. Infections of the parotid gland may be confused with toothache as a result of trigeminal nerve involvement. An inflamed parotid papilla, the orifice of the parotid duct in the oral cavity, may be an indication that the problem may be caused by the parotid gland rather than by a tooth. Diseases of the parotid gland cause pain to be referred to the ear, the TMJ, and the external auditory meatus. This is due to the overlapping of sensory branches of various nerves serving the regions of the parotid bed, ear, and TMJ. Mumps, a viral infection of the parotid gland that causes acute inflammation and profuse swelling of the gland, impinges on the auricula temporal and great auricular nerves, causing much pain as the gland is pressured during mastication. Occasionally, it causes orchitis, pancreatitis, and encephalitis. Fortunately, this condition has been mostly eradicated as a result of vaccination. Parotid tumors, tumors of the parotid gland may be excised, but extreme care must be exercised during surgery because any damage to the facial nerve will result in at least partial facial paralysis. Total destruction of the facial nerve results in complete facial paralysis, Bell palsy. Coelography of the parotid duct. Occasionally, calculus accumulations occur in the parotid duct, thereby obstructing salivary flow. Radiologic examination on injecting radiopaque dye into the parotid duct opening, coelography, identifies the blocked region, and the obstruction may have to be relieved surgically.